Hi everyone, now we are going to discuss about daycare anesthesia. First, introduction. In daycare surgeries or procedures, the patient is admitted, procedure done, and is discharged on the same calendar day. If the patient stays for one night, it is called as short stay surgery or procedure. Over the years, there has been tremendous increase in daycare surgeries or procedure due to the following reasons like decreased hospitalization and hence the cost, early ambulation, decreases the complications like pulmonary embolism, less incidence of hospital acquired infections, hospital beds can be utilized for another needy patients. The next one is preoperative assessment and pre-medication. Assessment of a patient for daycare surgery should be done to avoid on-the-spot cancellation which is very uncomfortable to the patient. So, the first one is pre-medication. Like indoor patients, the most important goal for pre-medication for daycare patient is to relieve anxiety. Midazolam is the benzodiazepine of choice for daycare patients. Patients who are at high risk of aspiration should be given prophylaxis with ranitidine and metoclopramide. Pre-medication with oral NSAIDs has been found to be very useful in reducing the requirement of opioid analgesics. The next one is nil orally guidelines are seen, that is 6 hours for light meals, 8 hours for full meals and 2 hours for clear fluids. The next one is anesthesia for daycare surgery. So, in anesthesia, the first one is monitoring. Routine monitoring such as SpO2, BP, ECG, and EtCO2 is necessary. Other than routine monitoring, bispectral index monitor to measure the depth of anesthesia is suggested for daycare surgeries. The next one is general anesthesia. In general anesthesia, the first step is intubation. To avoid the complications of intubation, especially post-operative sore throat, general anesthesia with LMA is always preferred over intubation. The next step is induction. Propofol is the agent of choice for induction because of its rapid, smooth recovery and antiemetic property. The next one is maintenance. Due to the lowest blood gas coefficient, desflurane has earliest induction and recovery, therefore is the inhalational agent of choice for daycare patients. In case of non-availability of desflurane, sevoflurane serves as an excellent alternative. The next one is intravenous analgesics. Non-opioids like NSAIDs can be used safely. Opioids should be avoided if possible. Remifentanil, because of its ultra-short half-life, is the most preferred opioids. The next one is muscle relaxant. Short duration of action makes mivacurium as preferred muscle relaxant for daycare surgery. Succinylcholine, in spite of having short duration, is not usually preferred due to the high incidence of postoperative myalgia. The next one is total intravenous anesthesia. This is the technique where only intravenous anesthetics are used. That is, the combination of choice for total intravenous anesthesia are propofol and remifentanil. The next one is regional anesthesia. Regional nerve blocks are simple and safe techniques for daycare surgery. In current practice, spinal anesthesia is frequently used for daycare patients, however, with small gauge pencil tip needles. Epidural is hardly used for daycare patients. Postoperative period. The common problems seen in postoperative period are pain, nausea and vomiting, sedation, myalgia, weakness and bleeding. Then in the postoperative period, the discharge decision should be with common between surgeon and the anesthetist. The aim should be fast track discharge, which means shifting the patient directly from operation theatre to phase 2 post anesthesia care unit. This will decrease the cost and facilitate early discharge. The next one is post-operative instructions for daycare patients. The patients should be instructed not to do important and skillful works such as driving, operating a machine for at least 24 hours. Patient coming from outstation should be advised to stay for one day near the hospital so that if any problem arises, they can be brought back to the hospital. Most often, the readmission is due to surgical complications such as surgical site infection. So, thank you.